Welcome to our Mock Interview Pro series, where today we're diving into the world of clinical management. If you're preparing for a clinical manager interview, you're in the right place. We're here to guide you through some key questions you might face, along with tips and example answers to help you stand out. Let's get started with our first question about leading a team through change. Can you share an experience where you led a team through a major change in clinical practice? What was your role and the result? Interviewers ask this to understand your leadership skills and how effectively you can manage change within a clinical setting. When tackling this question, consider these pointers. Think of a specific instance where you managed a clinical change. Clearly outline your role in guiding this transition. Discuss the strategies you used to facilitate the change. Highlight the positive outcomes you achieved. Reflect on what you learned and how you'll apply it in the future. Here's an example of how to approach this question.
In my previous position, I spearheaded the shift to an electronic health record (EHR) system. As the clinical director, I organized training sessions and collaborated closely with IT to resolve any issues. This proactive approach led to a 30% increase in documentation efficiency within just 3 months.
By the way, we're only covering a handful of questions in this video, but I've prepared a free PDF with all 30 top interview questions for Clinical Manager. It also includes example answers and tips to help you prepare with confidence. The download link is just below. Can you describe a time you developed and implemented a strategic clinical program? What steps did you take, and what was the outcome? This question is designed to gauge your strategic planning abilities and your impact on clinical operations. Here are some tips to help structure your response. Begin with the goal and necessity of the program. Detail the steps you took, including research and engaging stakeholders. Talk about how you implemented the program and the challenges faced. Share measurable results or improvements from the program. Conclude with what you learned and its influence on future strategies. Let's look at an example response.
I once recognized the need for a new diabetes management program. By researching best practices and engaging endocrinologists and nursing staff, we developed a comprehensive care plan. The program included weekly follow-ups and educational workshops, resulting in a 30% improvement in patient compliance and a significant drop in hospital readmission rates.
Can you provide an example of a difficult conversation you had with a staff member? How did you handle it, and what was the outcome? This question aims to assess your interpersonal skills and ability to manage conflict constructively. Consider these tips when answering. Select a specific situation involving conflict or performance issues. Explain the preparation you did before the conversation. Describe how you communicated with empathy and clarity. Outline the steps you took to resolve the issue and support the staff member. Conclude with the positive outcome and any follow-up actions. Here's a sample answer to illustrate.
I had to address frequent lateness with a nurse. Before our discussion, I reviewed her attendance records and planned a supportive approach. During our conversation, I listened to her challenges and worked with her to adjust her schedule. Her attendance improved significantly in the following months, demonstrating the effectiveness of our solution.
How would you handle a situation where two clinical staff members disagree over a treatment approach? This question tests your conflict resolution skills and your ability to facilitate professional discussions. Here's how you can frame your response. Acknowledge the disagreement and encourage open communication. Facilitate a meeting to discuss differing viewpoints. Promote evidence-based discussions focused on patient outcomes. Seek input from other experts if necessary. Guide the staff toward a consensus that prioritizes patient care. Consider this example.
I would bring both clinicians together to discuss their perspectives, ensuring each feels heard. I'd steer the conversation towards evidence-based practices, focusing on patient welfare. The goal is to reach a consensus that aligns with best practices, fostering a collaborative environment.
How do you prioritize tasks and manage your team during a clinical emergency? This situational question assesses your ability to lead and make quick decisions under pressure. Here are some tips to help you prepare. Quickly assess the situation to identify urgent needs. Communicate clearly with your team about immediate priorities. Delegate tasks based on each member's strengths. Stay adaptable and reassess as new information emerges. Conduct a debrief after the emergency to evaluate and improve. Let's see how you might answer this.
During a clinical emergency, I quickly assess the situation to determine the most critical needs. I communicate these priorities to my team, delegating tasks based on expertise. As the situation evolves, I ensure we're flexible and responsive, regrouping as needed to maintain efficient operations.
Before we wrap up, remember you can get all 30 questions, example answers, and step-by-step tips in a handy PDF, totally free. Just grab it below.